Many parents assume that a sore throat means a trip to the doctor's office for antibiotics, but most of the time that is not necessary. So here's how to tell the difference, and importantly, when your kid can go back to school. I'm Dr. Lena Vanderlist. I'm a mom of two and a pediatrician with UC Davis Children's Hospital, and today we are discussing sore throat. When we see your kid in the doctor's office for a sore throat, the majority of cases, around 80%, are actually viral and will improve over time without a prescription medication. So only 20% of cases are due to the bacteria Strep and require antibiotics. So how can you tell if your child may have strep throat versus a viral illness that is also causing sore throat? First, if your child has a runny nose and cough, it is probably not strep. So that can save you some time. But if they don't, then these symptoms mean strep may be more likely. If they have a fever, which is 100.4 degrees Fahrenheit or higher, if they have painful lymph nodes in their neck, if you look in their mouth and you see white pus or little red dots on the back of the throat, if they have vomiting and abdominal pain, this sometimes can be present, especially in younger kids. Many times you'll see a headache, and sometimes it might be accompanied by scarlet fever, which is a sandpaper-like red rash and a tongue that looks like a strawberry. The symptoms of strep start abruptly, so they were fine yesterday and today they have sore throat and fever. And also, age matters. Strep throat occurs most commonly for children ages 5 to 15 years old during the winter months. And strep is really rare to see in kids under 3 years old. If there is a concern for strep, then head on into the doctor's office and we'll confirm it with the throat swab. Now, whether it's strep or a virus, there are steps that you can take at home to help your child feel better. You can ease the pain of the throat with acetaminophen or ibuprofen, remembering to keep them hydrated with water, juice, and popsicles are always a favorite. Honey can be helpful to soothe the throat, but it should only be used for children over a year of age because honey can lead to botulism in young infants. For older kids who can gargle and spit, a warm saltwater rinse can also be helpful. Now for a really important part. Here are the things that you need to seek medical attention for. If your child has strep and their fevers are not improving after about 48 hours on antibiotics, if they're dehydrated and they're not drinking enough to urinate at least once every 8 hours, if they're having trouble swallowing their saliva or moving their neck, or if their tonsils look very asymmetric or very large, then in these cases, it's time to bring them into the doctor's office. Now for what all parents really want to know, when can my kid go back to school? For all sore throats, children should be 24 hours without a fever and have improving symptoms before returning to school. And if they're strep positive, we also want them on antibiotics for at least 12 hours. We discuss more about sore throat and strep in this episode of our Kids Considered podcast. Thanks for watching, and be sure to subscribe for the latest episodes of Little Lessons from UC Davis Children's Hospital.